Zimbabwe has an HIV prevalence of 13.7%. About 1.1 million people are on antiretroviral drugs. Statistics indicate that 60% of HIV cases are cancer-related. It is against this background that the First Lady, Amayoxilya Mnangagwa, has undertaken to prevent and curb HIV and AIDS through advocacy targeting all age groups in Zimbabwe. The launch of Angel of Hope Foundation has already transformed health services in the country. The free cervical and breast cancer screening program is one of the successful programs which has already benefited thousands of Zimbabweans. The First Lady is one of the youngest members of the Organization for African First Ladies Against HIV and AIDS in Africa. Domesticating the Free to Shine campaign initiated by the African ladies was just icing on the cake, as she has already been championing a number of similar activities in line with preventing HIV and AIDS. She launched the program at the Harare Agricultural Show, and the event was attended by different stakeholders.
I'm indeed committed to this cause and will work tirelessly to support the Ministry of Health and Child Care in the pursuit of an HIV-free generation and access to treatment for children and adolescents living with HIV to keep them AIDS-free. The launch of this campaign should spur us all to action, as our government is committed to eliminating new HIV infections among children and keeping their mothers healthy.
The partners, including the UN Resident Coordinator Mr. Bishop Parajuli, applauded the First Lady for her efforts towards improving health delivery in the country and pledged their support in ending HIV in children by 2030.
Through the United Nations continues supporting the First Lady's initiative, including the Domestication of African Union campaign to prioritize children, adolescents, and mothers in the Fight HIV and AIDS initiative and the subsequent launch in Zimbabwe today. Let me seize this opportunity to congratulate the First Lady on our engagement and proactive leadership in this regard.
The Free to Shine campaign is an important step in our OAFLA's efforts to create an AIDS-free generation. This campaign will catalyze action among governments and community leaders towards ECPAF's and OAFLA's shared mission of preventing mother-to-child transmission of HIV.
The First Lady, who is an ambassador for women and child care, visited stakeholders in the health delivery sector with the aim of encouraging them to provide quality service to the populace. The Angel of Hope Foundation has, in a short space of time, managed to partner local and international partners, a development which has seen Harare Hospital being the latest beneficiary. A local hardware company which has already identified itself as a friend of the Angel of Hope Foundation refurbished Harare Maternity Hospital ward, thereby contributing to the improved social service. Harare Central Hospital is a referral and training center which provides quality specialist care to all referral and complicated patients. Like most health institutions in the country, the hospital has not been spared by the economic challenges.
If we are not directing our attention to health sector, then I think we have no future. So it's important for us to be thinking futuristic and to help and step in wherever we can.
Amai Mnangagwa's charity works have positively impacted a number of people across the country, which saw a Harare couple naming their daughter Auxilia. The First Lady met Rachel Maunga, mother of the child named after the First Lady, in January this year. The couple has since been offered a job by Friends of Angel of Hope Foundation. On becoming the First Lady in November last year, Amai Mnangagwa undertook surprise visits to hospitals to assess the situation and to have a first-hand experience of what patients go through at the country's health institutions. Her visits have paid off with noticeable change of attitude by hospital staff towards patients.